This is One-on-One. Hi, Steve Adubato. We're coming to you from the offices of the Robert Wood Johnson Foundation here in Princeton, New Jersey. We're here joined by our good friend, Dr. Josh Bershad, who is Senior Vice President and Chief Medical Officer, Robert Wood Johnson University Hospital. Good to see you, Doctor.
Good to see you, sir. How are you today?
Doing great. We're here at the foundation, so things are real good here in Princeton. Talk to us about hospital readmission rates and the fact that they're too high. Patients come back too often, and there is an initiative that your hospital has collaborated together with the foundation on to reduce the number of people who come back to hospitals, right, Josh?
Sure. So, Steve, one of the problems that people have talked about in the media and patients have experienced recently is patients that, what we say, bounce back and forth between the hospital and another setting. Another setting could be their house. It could be a rehabilitation facility, what we say is subacute, but a rehabilitation facility could be a nursing home. It could be a home care. Could be anywhere else, and they go home, and perhaps everything's not, all the T's are not crossed and the I's are not dotted, and there are things that we could do to help them have a better chance at staying at home and in good health. And so we've worked with the Robert Wood Johnson Foundation through their generous support on something what we call the Robert Wood Johnson Community Care Coordination Initiative.
Community Care Coordination Initiative. What's its goal?
Its goal is to improve community care coordination of resources, but we're measuring that by preventing readmissions to the hospital.
Give us an example of what is going on and what you're trying to stop in the process.
Sure. I always think the best way to look at this is if we take a patient.
Yep.
So if we take Mrs. Smith, is 60-something years old. She has a bunch of different health issues, and she goes home from the hospital. Let's say she was admitted because she had a heart attack. She goes home from the hospital. It's a scary time for a patient. Patient goes home. They're on a bunch of new medications. They might have a bunch of new physicians that they have to see after they're released from the hospital. And there's a lot of things that have to go right in order for them to stay home and to stay in good health. And sometimes those things just don't happen exactly. And the goal of this initiative was to affect people like Mrs. Smith and try and increase the chance that things go right. So make sure that, let's say in the old days, she went home and she had 7 new medications. So someone in her family or the patient themselves had to go to the pharmacy. They had to fill the medications. They had to make sure that the 3 medications that they were taking before they were in the hospital were the right ones, and they now match with the other 7.
That's a lot, Josh.
It's a lot of medications. Now there's 10 medications. They have 2 new doctors they have to see, and they have to see them quickly. They have to call the offices. They have to get appointments. And there may be other things. They're supposed to start an exercise program. They're supposed to go to cardiac rehab. There's a bunch of different things that are complicated for a patient who, of course, is scared.
Right.
Patient's scared, they had a heart attack, they were in the hospital. This is all new to them. And so our job in this program is to make that whole transition process between the hospital and the home easier and safer.
How? And by the way, what has the foundation done to help Robert Wood Johnson University Hospital do this?
So the foundation gave us a financial grant, which we've used to do 2 things. I would say it was a 2-pronged attack. One is an information piece.
Information? What does that have to do with it?
So one of the challenges is what I described for Mrs. Smith, where multiple doctors, pharmacies, perhaps a cardiac rehab center, a hospital, and many other providers of care. They all have to see the information about what Mrs. Smith experienced, what happened to her. And that information is not always available easily. Sometimes it's on paper, sometimes it's electronic, but it's not connected. So one prong of our Community Care Coordination Initiative was to connect all these sources of information through technology. And so what we've done is we've connected over 675 physicians, 16 post-acute care facilities. In real terms, those are nursing homes, rehab centers, and others who are in the community.
And they're all connected. How?
Connected via something called Relay Health. Jersey Health Connect is an organization. There are many hospitals that participate in it, many physicians, many other providers. And so we've connected it so you can access the record of what happened to that patient.
So Mrs. Smith.
Mrs. Smith.
She's in this situation.
Yes.
How does that system of information help her deal with her situation?
So Mrs. Smith goes to see the cardiologist after she goes home from the hospital, goes to see the cardiologist. The cardiologist has a question about what some tests showed. The new cardiologist wasn't the person in the hospital. They could try and get the medical records in the old days. They'd call the hospital, they'd have to sign a bunch of paperwork. Complicated. This way they log on to the system, they pull up Mrs. Smith's case, and that information has been sent from the hospital to this big database, and they can look up Mrs. Smith's information. Now the doctor knows the answer to that test, makes a quick decision, much faster, much more efficient, much safer for the patient.
Does that, by itself, before you move to the second part of it, Doctor, does that reduce the odds that Mrs. Smith will wind up back in the hospital?
It's a great question, Steve. I don't know the answer. we presumed that information flow was going to be one of the critical factors.
Right.
We all, as physicians and healthcare providers, experience this challenge all the time when we see a new patient. We never have all the information we would like to have. And so we made the assumption that helping to solve that problem would help prevent readmissions. I don't know the proof of whether that piece...
We don't have enough data yet.
Correct.
Got it. Give me the other part of it.
The other piece of it was that Mrs. Smith also is scared, has all these new medications, has different things in her home. Maybe she needs to be on a low-salt diet. She goes home and she doesn't have the support. So the second piece is what we call transitional care.
Transitional care. Transitioning from the hospital to?
Next setting.
Got it.
Whatever it may be. And so what we're doing is we're sending a nurse into the house, into Mrs. Smith's home, with her permission. And what that person will do is sit down at the dining room table, take all the old medicines and the new medicines, and make sure that Mrs. Smith is taking the right medicines now. They'll make sure that Mrs. Smith has that appointment that she's supposed to have with the cardiologist or her primary care doc or somebody else. They'll make sure that she has an appointment that she's going to go. They may call that provider and make sure that they have the information that they need, and perhaps get them signed up for the electronic network that we talked about if they're not. So again, now Mrs. Smith has a much greater chance of taking the correct medications, attending her appointments that are needed, getting to cardiac rehab. They might look at the food in her pantry with her permission and say, hey, you know, this is really high salt food. You know, let's talk about how you could have a better diet that would support you.
But Josh, the thing that is striking me about this, and the time I have left, you told me before we did this interview offline, that one of the things you want to make sure is that nurses and other healthcare professionals are working to the scope. What did you say?
I said the highest scope of their life.
What does that mean?
Sure. So I think one of our challenges for the entire healthcare system is that everybody at any level of training does the highest level of work that they can do. For example, a nurse may be able to do many things that are done by a nurse practitioner or a physician today. And so we want that nurse to do it. One, that spreads resources. It makes more people available. One of the things we're going to do with this grant is we're going to experiment with something called Grand Aids. Grand Aids. So Grand Aids are a group of people who have less training than a nurse, but there's some research to support that they could do this transitional care process the same way a nurse does.
Is this less expensive too, which would then potentially reduce the cost of healthcare overall?
Exactly. It is a less expensive alternative, and it would free up nurses to do work that only a nurse could do.
More efficient.
More efficient.
And potentially reduce the readmission rate for patients going back into the hospital.
Yes, that's correct. With a less expensive resource.
And that is what this grant is helping to do from the Robert Wood Johnson Foundation.
It's one of the aspects of the grant. We're going to try it as a pilot in the middle of this grant.
And could potentially have implications across this country.
Yes. Others have studied this. Arthur Garson is the leader in this field. He's Dr. Arthur Garson from UVA. He's the leader. And there's some research to support that this is a technique we should try. And so we're going to try it here in New Jersey with our patients and see if we can improve upon those outcomes.
Fascinating pilot. We are pleased to be joined by our good friend, Dr. Josh Bershad, Senior Vice President and Chief Medical Officer, Robert Wood Johnson University Hospital. Thank you, Josh. We are, in fact, coming to you from the offices of the Robert Wood Johnson Foundation. I want to thank you for joining us. Thanks, Josh. We'll be back right after this.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by New Jersey Credit Unions, the Robert Wood Johnson Foundation, MD Advantage Insurance Company of New Jersey, PSC&G, the law firm of Gibbons, P.C., Activus, in cooperation with the American Medicine Chest Challenge, and by Cone Resnick. Promotional support provided by the Star Ledger, powering NJ.com, and by NJ Biz, all business, all New Jersey. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.